Hi, Rachel. We are here today at the Delaware Valley Stroke Council and the Thomas Jefferson University Neuroscience Department's stroke screening. Can you tell me a little bit about stroke and what we should look for?
Okay, for the normal layperson, the easiest way to determine whether or not someone is having a stroke is to basically go by the mnemonic FAST. And that stands for F, it's face. You look at this person and you determine whether or not they are having any kind of facial drooping. Ask them to smile, and if their face can, lift on both sides and it's symmetrical. Next is A, and that stands for arms. You want to ask them to raise both their arms up and see if they can. If one side is not, able to be lifted, if they're not able to lift their one arm, then you know something is going on. The next is S, that stands for speech. You ask this person to say a word, try to get them to talk. If they're slurring or something, they possibly could be having a stroke. And the last is T. T stands for time, and basically time is of the essence. The moment you see these symptoms, you want to get them to the hospital. You want to call 911 because with a stroke, time is of the essence. The faster they get to the hospital, the better outcome that they have.
And isn't there a certain time measure? Isn't it within 3 hours there's a greatest...
Okay, if that number is 3 to 4.5 hours for an ischemic stroke that they can administer a TPA, which will basically break up the clot.
So they have a pretty good possibility of surviving if they can get to the hospital
with minimal damage. If they can get to the hospital within that time, then this medicine can be administered.
Great. Thank you so much, Rachel. I really
You're welcome.
appreciate it.